2 weeks ago, I posted a vlog-style video where I revealed all my anti-aging secrets. Since then, the video has gotten almost 100,000 views and thousands of comments. Some of you don't believe that I'm 4 years from my 50th birthday, and some of you think my anti-aging regimens are just over the top, and some of you think that my videos are just way too technical and scientific. But for the most part, most of you were kind, supportive, and had amazingly insightful questions and comments. So I'm going to take you through another day in my life where I expose some of the secrets of the anti-aging and beauty industry and talk about more of my anti-aging secrets and regimens. As a bonus for my subscribers, I'm going to select some of your questions from the comment section and answer them throughout the video. This video is dedicated to my beauties who love truth and science, and I'm not holding back in this video. Are you ready? Okay, let's go. It is 4:42 in the morning. All right, let's go, guys. On my way to the gym Monday through Friday. My exercise regimen will include spin, bar Pilates, and then I work out with my trainer Casey in the gym where we lift. Lifting has anti-aging effects. The more muscle you have, the higher your metabolic rate is, and it also helps with endocrine pathways and your hormone levels. Not a runner, I do love to run, but I do feel that that long-term has an aging effect on our face. Studies have shown that you can have a decrease in your facial fat pads because of something with the free radicals that happen as you run that melt away the fat in your face. So I've always been really mindful of that and doing cardio that won't pull on my SMAs or my facial ligaments or cause volume loss in my face too much, because I already get kind of gaunt and thinned out when I lift and when I do cardio. So I try to stay away from activities that are going to age my face. This is my drive to work every day. Not gonna lie, it doesn't suck. I just love seeing the ocean. Even if I can't go in the ocean and play in it every day and surf and swim, just being next to it and breathing it and living next to it and smelling the beautiful ocean air, it just makes me feel calm and at peace. And that's probably because I've always lived close to the ocean my entire life. It makes me happy. So just going into the office now, it's so fun because I get to see my patients and do the things I love. Lasers, energy-based devices, injectables, make people look and feel their best. The morning hustle is a little rough. I have to get both kids off to school. I work out at 5 a.m., get my lunch packed, my protein shake, like everything ready. And then when I go in the office, it's just 8 hours of just straight fun. And I actually do intermittent fasting. So I just broke a 16-hour fast after working out, having my smoothie and taking my supplements and my collagen peptides in my matcha tea. I'm going to work 8 straight hours, and then I'll have my late lunch / early dinner after clinic is done, and that will break another 8-hour fast. There's a lot of research supporting autophagy and intermittent fasting for like anti-aging and overall health. I do think that intermittent fasting fits best with my lifestyle, so I'll do another 8-hour fast right now and then eat my cushy meal, which I have with me, after I'm done seeing patients and seeing my beauties in my office. A lot of people have commented my level of discipline is not feasible for most people. I'm the first to admit, I'm not going to deny, I'm type A, and I can't change who I am, and that's how I'm wired, but that carries over into my professional career as a dermatologist with a private practice. I want to serve my patients and be the absolute best for my patients. I don't cut corners, even with my skincare line. Could I just have some company make some products for me, slap a white label on it and call it my line? Of course, but I wanted to be in the lab, having my hands on every active ingredient in those products that are going to give next level results and only have the most innovative technology, active vehicle delivery systems, active ingredients. And that's why the skincare line, if you've tried it, it gives results within days. There's a difference. And unless you experience using a skincare line that was formulated by someone who has dedicated his or her whole life to formulating a skincare line, and then you use another skincare line which was like a white label, you'll see the difference. The reason why I do YouTube is to really be an educational resource for you guys and a non-sponsored dermatologist. You really sometimes can't tell when someone's sponsored. They don't always have coupon codes. They don't always have paid partnerships on their hashtags, and they should, because I feel like it's like really misleading. I feel like I'm a rare dermatologist on YouTube because I don't take any paid partnerships. It's just not worth it to me to give up my education and integrity. There's no amount of money or subscribers that I would be willing to jeopardize my integrity and the 15 years of my life that I've dedicated to getting here. So that's it. Okay, you guys, we are at the office, locking my car. I have everything with me. Look at all these things I have to bring with me. I have my I have my doctor's coat, my white coat, my cushy meal lunch, which is clean, so I can ensure that no matter what the office staff orders for lunch, I'll be eating clean. I have my water, so I can drink in my 2 liters of water a day. I've already done my exercise, got the kids off to school, got my workout in. I'm just hearing myself talk, and I know I sound super type A. I am type A, you guys. I can't stop being type A. This is how I am. People always comment like, you're so disciplined and you're so regimented, but I've just been like this my whole life. That's just who I am. So love it or leave it. That even applies to me being a dermatologist. Could I have just gone to nursing school and opened a med spa? Probably, but I wanted to be a doctor. I wanted to get my MD, even though it was a harder path. I wanted to do a derm residency where, you know, I probably could have just been a family practice physician, and it would have been a lot easier to match in a family practice residency, but I wanted to master my specialty. I wanted to do a derm residency, even though it was very competitive, and even after that I did a derm procedural fellowship so that I could just be a master of my subspecialty, where I feel like a lot of people cut corners, but I'm just not the type of person to cut corners, whether it comes to my career as a dermatologist or as a formulator for skincare line. Hi. So these are these cushy meals that I get. They were recommended by my trainer just so I can make sure that I eat clean, when sometimes, you know, in the office they order lunches and stuff that isn't as clean. This is grilled flank steak, this is the dinner, and then this is the lunch. So it is an Asian kale Caesar salad. So like they come every day and they have different options, and I either just do the keto or paleo or just the signature, which is just clean. So just make sure that I get clean food even if it's not around me. My poster child.
Oh my god, thank you.
Serious. It's looking good. I'm gonna do a little bit extra process on the areas where it's pigmented here. Yeah. No pain, right?
No, none.
Good. Ready?
Yeah.
You're gonna probably jump without me and do 1, 2, 3. Oh, you did it.
Not bad.
Good. Good job. Okay, I'm gonna do that on the other side, okay? There we go. 1, 2, 3, Alice. You okay? Good. Sorry, babe. Sorry. And you're gonna jump without me too. They're disappearing now. They're all gone. Okay? 1, 2, 3. That's what it's like. You okay? All right. Sorry, babe. Stephanie and I both do this to ourselves, so we know what you're going through. You okay?
Yeah, I'm just flinching. I can't control it.
It's like involuntary. I know. You're okay. You're doing great. Good job, babe. Good job. You okay?
Yeah.
You do good. Hi, my beauties. So I am strapped up to an Emsculpt machine, and since I'm just laying here getting my Emsculpt treatment, I wanted to answer one of your questions. First and foremost, because I know you guys are going to have questions, this is Emsculpt, and Emsculpt uses HIFEM technology. So HIFEM just stands for high intensity focused electromagnetic energy, and it helps recruit all your muscle fibers, slow twitch, fast twitch, for recruitment of 100% of your muscle fibers to get these super maximal contractions which build muscle. I lift and I go to the gym and I work out 5 days a week and I eat clean, but this is like my secret weapon, and I do this once a month to just keep my abs and my glutes toned and as large as possible. So this is what it looks like. So the question is from Dr. M6152, and she asked about hair regrowth solutions. I always say to anyone who is noticing a decrease in hair density, it could be from a multitude of different factors. And I've actually done a whole YouTube video on supplements for hair regrowth. In it, I talked about the importance of visiting your primary care physician or an internist to make sure that you're healthy, get your labs checked, make sure that you're not anemic or have any thyroid abnormalities or vitamin deficiencies. But getting started on like a really good multivitamin supplement containing various multivitamins, minerals, antioxidants, which I talk about in my video, will help restore hair growth, but it does take time. It takes about 3 to 6 months of being on a supplement and dietary improvement to show the results that manifest with hair regrowth. And it's always a good idea just to get a workup by your primary care doctor, get your labs checked, just to make sure that there's no ailments that are contributing to hair loss. Hair loss can happen from stressful events or traumatic events that happened 3 months prior. There's lots of different forms of hair loss from very multiple causes. I always say get a workup, start on a multivitamin. Nutrafol is one of my favorite vitamin supplements for hair restoration and regrowth. Again, I'm non-sponsored. I have no ties to that company. I just have seen my patients do really well with that supplement company for hair regrowth. And then also PRP, although I'm not a big fan of it for anti-aging and rejuvenation effects because it doesn't really have a lot of data backing it up for that, but it does have a lot of research and data backing it up for its effect on hair regrowth. So PRP for scalp treatment for hair restoration is actually a really good treatment for hair restoration as well. Hopefully this helps. Finishing up a fun, I just ran into the wall, a fun day in the office, and I wanted to just answer one more question before the day is done. So this is to answer the question asked by Mama Tobes, and she asked me to answer a question on like peels, in particular a Jesner's peel and a TCA peel. I love peels, and I think peels are really useful in helping and improving the texture and tone of the skin. Texture meaning pore size, fine lines, wrinkles, acne scars, and the tone meaning hyperpigmentation, whether it's melasma, cloasma, post-inflammatory hyperpigmentation, ephelids, which are little freckles, or NAPIH. As far as treatments that are more impactful, I feel like lasers are a lot stronger and more powerful, but also they require a higher level of skill. So to find a dermatologist or laser specialist who understands lasers and understands how to use them may be more challenging, but I love peels as well. Compared to lasers, I don't feel that they come close to the results of a laser, but I do feel that they're a great adjuvant for improving the skin. So the types of peels I really like for my patients include superficial peels and either superficial to medium depth peels, whether it's a Jesner's or a TCA. I really love the Zeo Skin Health 3-step peel. I love a light glycolic acid peel. I feel peels are really, really important and impactful and can be used in any version, whether it's superficial mid, or even deep peels like phenol peels, which are a little bit more risky and require cardiac monitoring and a little extra level of care, but they can do a lot for the skin. Now, when compared to lasers, lasers are always going to be my favorite because I just knock it out of the park and get next level results with lasers. But it's not that I don't like peels. I love peels, and I feel that the more that you can do to the skin and target certain ailments, whether it's acne scars or melasma or sun damage, through different mechanisms of action, meaning through a laser, using photons or collimated light, using a peel to help superficially exfoliate the skin and stimulate collagen and remodel scars, and then using things like subcision or other treatments for, in the case of acne scars. The more you do and the more angles that you target, the better the result is. So it's not that I don't like peels. I love peels. I've actually done a whole YouTube video on peels and their usefulness and how they can help the skin. Next question is from Blake Ryan. Blake Ryan asked about intermittent fasting, if I could talk a little bit more about it. There is a lot of data and research showing the benefits of autophagy and intermittent fasting and what that does to your endocrine profile, circulatory system in the blood, and your hormone levels, and just the impactful effects they can have on anti-aging and telomeres and so many different other cascades that are really important with scientific-based evidence for intermittent fasting. I personally do it and have done it my entire life. There's a lot of data supporting it, and the way that I do it is I do 8 and 16-hour fasts, and I usually eat twice a day. But depending on the day, and even on the weekends when I'm with my family or my friends, I don't adhere to that strong of an intermittent fasting schedule. But during the work days, when I work Monday through Thursday, this is when I do my intermittent fasting, and I feel that it has had anti-aging benefits as well, not only on your skin, but in your immune system, your neurological system, your endocrine system, all body system, organ systems and functions, I think, benefit from intermittent fasting. Tia Padkick asked me what sunscreen I use, and I really love, for my, there's Stephanie, say hi! And I really like Color Science. Color Science is like one of my favorite sunscreen products or formulators, because I feel they use iron oxides, which are really helpful for protection against environmental pollutants, blue light and visible light that can be emitted from our devices and break down collagen, which can cause premature aging. And I also love Color Science because I use titanium dioxide and zinc oxide, which are mineral-based sunscreens. I'm not against chemical sunscreens, but I just feel that mineral-based sunscreens cover the entire UVA spectrum, UVA1, UVA2, UVB, UVC, and they also protect against a lot of areas in the UV spectrum that often get missed by piecemeal chemical sunscreens. That's why if you look at a chemical sunscreen, there's so many active ingredients listed, versus like a mineral base, it's either like zinc or titanium dioxide, and that's pretty much it. I do like Color Science though, because I feel it's a very elegant formulation, and that's why I don't wear makeup on my skin. Color Science is like wearing makeup, but it's makeup with protection factors in it. And because it contains those iron oxides, it provides an extra layer of protection against not only UV light, but the lights emitted from our devices, fluorescent lights, and environmental pollutants. I mean, there's fluorescent lights all over that are trying to break down our collagen. I just finished my clinic. I just did an amazing thread lift. It was so much fun. I love doing PDO threads. I'm in my car, and this is the lunch that my amazing staff got me. It's just basically chicken and greens and vinaigrette dressing, and I didn't have time to eat this today in clinic. I just have been seeing patients for the last like 6 to 7 hours, and I have to head on to my son's volleyball game, and so I'm literally just gonna kind of like scarf this down in my car. But I just try to eat clean even when I just have to eat on the go. I usually do salad. This is a Mediterranean salad with chicken. I usually do a salad with some type of protein, so usually chicken or fish. I stay away from red meat and don't really eat any other type of protein besides chicken and fish, and I'll usually have it with like lots of greens and healthy vegetables or a salad. So I'll eat this really quick. I'm gonna scarf this down in my car. This will probably be my last meal of the day. If I do get hungry, I'll have something light for dinner, and I won't have anything past 6 o'clock at night. That's usually what my trainer likes me to do. Have, you know, some sashimi or something healthy, or like even like hummus and veggies for like a little late night snack while my kids and my family eat dinner. So that's what I'm doing. Just a mom on the go, trying to eat clean, stay healthy, just keep up with balancing kids' activities with work and self-care, and just respecting my body and putting good food into my body. So I feel like that has a tremendous effect on the aging process. And, you know, at 46, I have to just be careful what I eat. I can't just eat processed foods or, you know, something quick that may not be as healthy for the sake of convenience, because as we get older, you know, we need to up the antioxidants, up the nutrients in our food, and just stay away from sodium and processed foods, because that can age us really fast. Glycosylation and, you know, telomeres, cell health, cell death, apoptosis, autophagy, I think is really important to consider as you get older. And intermittent fasting, although it's something that really works well with my schedule, and that's something, my eating pattern that I've done my whole life, there's a lot of science and data in autophagy and fasting and how it can prevent the aging process from happening. So I'm a firm believer in it. I've been doing it my whole life, and it's worked out for me. So I recommend it for my patients as well. Okay, so just leaving work and taking my daughter and her bestie to jiu-jitsu, and we're in Starbucks getting a quick little coffee because I need a coffee. Okay, never a dull moment. This is my mom's life. Okay. So I'm here for a Thai massage. I usually get these once a week because I get shoulder and neck strain from doing lasers and surgery all day, and it just really helps relieve that tension. That and trapezius Botox. So green tea, polyphenols, and pineapple contains arnica and bromelain, which is so good for the skin for anti-inflammatory. So this is a little post-massage treat, which is so good. So just here picking my son up from surf practice, and it's just, you know, juggling life as a mom. But I want to be a very present mom who's involved with all of my kids' activities, help them with their homework, and be really, really present. It is hard to balance being a good mom who's present while working and just balancing my career, but it's really important to me. It is a struggle and it is a constant balance, and half the time I'm super exhausted, but it's definitely worth it. So with my son being a competitive surfer, sometimes it's really early mornings, and sometimes it's really late in the evenings. They do it year-round, rain or shine. Part of being from California, and I grew up as a surfer and lived on the beach, and I just love his connection with the ocean. I have that same connection. So I'm going to answer the next question from Stanley King Chan. How do you maintain the skin on your body? We're always focused on our face, our neck, and our chest, and our backs of our hands, but for your body, I usually actually just use a CeraVe cream, and I use it after my shower, either morning or night, or sometimes both, and I mix it with a little 0.05% tretinoin, so almost like a dime-sized amount of tretinoin with like a big dollop of cream. Mix it in the palm of my hands and apply it to my arms and legs and my abdomen too. After 2 babies, I need all the tightening on my abdomen that I can get, but between using that for my body skin, I have done thermage on my abdomen a couple times. I've never had a tummy tuck or anything like that, but I've been able to do treatments on my skin on my abdomen after having 2 babies, and I think I've been able to maintain that skin. But for my arms and legs, I usually just mix a tretinoin with Cetaphil cream. I talked about that in another video too. Also using Amlactin is another drugstore AHA that you can use that's over the counter. I think it's like maybe $12, and you can use that morning and night on your arms and legs. It does sting a little bit, so if you shave your legs, be careful on applying that to your leg skin, but that's a great way to save money. Amlactin for the body, a tretinoin mixed with CeraVe for body skin.
I was over there. It was falling hard and so fun. And then there was like, and then over there by the rocks, right now.
Yeah. Did you have fun?
So much fun.
You ready to go home and have some dinner and do some homework? How'd you do on your, why don't you have homework?
Because I did all the work.
Oh, you're so good. Just like me. I was pregnant with him when I was still a resident, so technically he graduated from UCLA and did a derm residency. Right, bud?
Yeah, and if I went to UCLA again, I'd graduate twice.
You would. A question came up and someone asked me about topical estrogen creams, and this has been something that I've been asked a lot. The thing with hormone replacement, whether it's exogenous, meaning coming from a topical cream that's getting diffused through the skin, or endogenous, meaning coming from within through a birth control pill or hormone replacement therapy or a shot or a Depo-Provera or a pellet, there's differences that the estrogens and hormones can have in our skin. Spending decades of my life looking at skin under the microscope and looking at skin histology, reading out with dermatopathologists who are looking at biopsies confirming melanoma or atypical nevi or dysplastic nevi, I've learned a lot and have a different vantage point than most formulators or people in the skincare industry. My take is this: everyone's different, and I always think that it's best to follow up with your primary care provider, your dermatologist, and your OB/GYN, or just your GYN or your OB. And the reason is because it's a controversial topic. You have to do your due diligence, do your due research, and the information that I provide to my patients is gathered from the literature that I read. I keep up to date. I keep up to date with my board certification, which means keeping up with my reading and testing and assessment every 4 to 5 months, which is a lot, which keeps me on my toes as a dermatologist. So first of all, cite your source and get your information from people who are in the medical industry, board certified physicians in their specialty who are keeping up to date with information, because the information is always changing. But I wanted to touch on a point. When we sign out with dermatopathologists and we're looking at melanocytic lesions, melanocytes are the pigment producing cells in the skin. When a patient is pregnant or postpartum, those cells look a lot different under the microscope than when they're not pregnant. For example, if a patient has a history of dysplastic nevi, which are atypical moles that could be considered pre-melanoma or precancerous, and they come in for regular mole checks and they have regular biopsies, you can compare the biopsy to those melanocytes from the same patient when they're, say, before pregnancy and after or during pregnancy, and those melanocytes look totally different. And it's always an interesting call because the dermatopathologist doing the sign out, meaning giving the diagnosis, which is going to have an effect on the care, the treatment plan, what the surgeon's going to do, how big the margins are going to be, if they're going to operate or not. There's a lot that depends on that diagnosis from that derm path reading. When the melanocytes are atypical or scary looking to where they could be possible pre-melanoma, they're revved up, there's mitotic spindles, there's mitotic figures. The cells and the melanocytes look different. They look different when a patient is pregnant, when they're not pregnant, and they have to adjust the call when they diagnose a certain skin ailment on a biopsy histopathology specimen. So not to sound too technical, and I know that some people get mad when I get too scientific or technical, but if you're following me, you're down with it and you want to educate yourselves and become smarter, especially in this industry where there's a lot of people faking it and really don't know what they're talking about, but want to sell a skincare product or want to open a med spa. This is the truth, you guys, and we're here. So my vantage point and my perspective is, given that melanocytes and skin cells look different under the microscope when there's estrogen circulating throughout the system during pregnancy, I don't think that that would be an ideal topical cream to put on the skin. Estrogens do other things. They vasodilate, they cause telangiectasias. That's why during pregnancy you'll get broken capillaries on your face. The pigmentation in your whole body will get darker. You'll get darker areola. You'll get darker existing moles that get darker because of pregnancy. You get the linea nigra, that brown line down your abdomen that I swear mine would never go away after postpartum, but it finally did. But there's lots of different things that happen. So you have to remember that topical estrogen on the skin may not be all that it's proven to be, because there's downside, there's risks that may outweigh the benefit. Of course, we know estrogen is great for the skin. People who are premenopausal, perimenopausal, and postmenopausal, their skin thins, the dermis thins, the epidermis thins, the subcutaneous fat thins, the skin thins out and looks like it's sliding off the face as we lose our estrogen. So we know that estrogen loss can cause these changes, so estrogen gain must negate these changes. However, it's different when you're talking about it in a topical cream, and it's also controversial when talking about hormone replacement therapy. I'm very forthcoming and transparent with my patients and on my YouTube with the things that I've done and the things that I take, but when it's more controversial, I have to be careful because what I'm about to say is probably going to cause a lot of controversy. But I am on a low estrogen birth control pill. I've been on it since I was 18. I'm 46 years old now. The only 2 times in my life where I took a break from my birth control pill was to have babies, and each baby that I had 3.5 years apart, I breastfed for 18 months each. And during that postpartum period when I was breastfeeding, I was not on the pill. But every other time in my life, from the age of 18 to 46 now, I've been on low estrogen, and my OBGYN and my family practice and my internist, who follow me very closely, I'm seen every 6 months and have lab work done very regularly, and my health is of the utmost importance to me. They all recommend that I stay on this low estrogen pill. It's a very low dose of estrogen. My body's very used to it. I don't have any issues with weight gain. My skin looks great on it. I don't have any mood disturbances, and honestly, I've spent more time on my life on it than off of it. Now, there are controversial risks that happen with HRT with respect to the increase in breast cancer risk, but it also decreases ovarian cancer risk and endometrial cancer. So not to get into a controversial topic because I hate controversy, but I want to be forthcoming and let you guys know that I am on a low estrogen birth control pill, and I have been since I was 18, with the exceptions of my 2 pregnancies. And that probably has an effect on my skin in a positive way. Okay, my beauties, I just got my kids to bed and the house is quiet. We actually have some house guests staying with us this evening, so I had to sneak in here in the bathroom and I wanted to answer some more of your questions. The next question was from Laura G6996, and she had a great question, and she said, if lasers or in-office procedures aren't in her budget, what things can she do to maximize her skin health and rejuvenate her skin when on a budget? And that's a really valid question, and I'm glad that you asked that. And I had several other questions along these same lines. As a cosmetic dermatologist, of course, I post in-office procedures, including lasers and tightening devices and all the in-office procedures, which I do on myself as well, but sometimes that's not in our budget. So going like by level of tiers, if you can't afford in-office procedures, investing in skincare is actually something that's really impactful, especially over a lifetime when you're talking about your skin. Using high quality medical grade skincare products that have technology can actually make a huge difference and a huge impact on the skin. Medical grade isn't really a terminology, it's more of like a marketing term, but when I think of medical grade, I think of skincare products that you use at home that show results and actually change histologically the skin cells and the way they behave. And when you look under the microscope, the before and afters, you see histological or cellular changes that correlate with clinical outcomes and improvements in your skin, your texture, your tone, resolving ailments like rosacea or acne or seborrheic dermatitis or melasma and things like that. If you can't afford medical grade skincare or skincare that has a little bit more technology, a little bit more innovation in it with better results, then you budget for maybe one medical grade skincare product that targets a certain ailment that is your skin's worst problem. So say melasma is your most presenting symptom of a skin problem, then you target more medical grade products that target melasma, vitamin C's, antioxidants, lighteners, brighteners, and things of that nature. And then you can kind of supplement the other parts of your skincare regimen, like the cleanser, the exfoliant, the sunscreen, with more drugstore, more affordable products. So you can kind of just target the one medical grade product that you need if you are on a budget and can't get a whole medical grade skincare regimen. Focus on that, or get the miniature sizes. Even my skincare line MDAiRE, we have mini sizes, or if you subscribe to my YouTube channel, we do giveaways all the time. And so trying to like get, certain medical grade skincare products on a deal, or like when you do a giveaway, like with my line, just try to work your way around getting your hands on any medical grade skincare products you can. If that's not an option, going to drugstore or even Amazon, Target, CVS brands, there's certain key components you can get on a budget. For example, Differin adapalene, and it doesn't have to be Differin, that's just the brand name that I know, but adapalene is an active ingredient, and it used to be prescription strength when I was a resident, years and years ago. It actually is a very impactful vitamin A derivative that's useful for acne and anti-aging as well. So you could get, some over-the-counter retinol or adapalene. That would be great to have in your skincare regimen, and it doesn't have to be medical grade or expensive. Of course, you'll get better results with the medical grade, but if you're on a budget, it's something that you can do that will make a difference. And then, using a sunscreen, it doesn't have to be a cosmetic line or something like Color Science or Ulta MD. You could just get a good sunscreen that you can buy from the store that you'll be able to use. And they always say the best sunscreen is the one that you'll actually use. Using a sunscreen throughout your whole life, it's never too late to start if you didn't start in your 20s. That's okay. Your skin's a dynamic organ system. It's going to respond to stimulus, and it's an ever-changing cellular organ system that is going to adapt to changes even if you're adapting them later in life. So that's okay. So those would be my recommendations. And then if you can't get drugstore skincare products, then just living a healthy lifestyle, getting as much sleep as you can to lower your cortisol levels, meditation, yoga, do something every day that finds you peace and balance, and that will actually have a dramatic effect effect on your skin. Your skin is an outward representation of your internal health. So if your cortisol levels are high, if your hormones are fluctuating, if you're stressed, if you're not getting enough sleep, if you have anxiety, these are going to have effects on your skin. It's going to flare inflammatory dermatoses like rosacea, seborrheic dermatitis, perioral facial dermatitis, psoriasis, acne, all those things. So just maintaining a healthy balance and centering yourself, whether that's a long walk on the beach or yoga or FaceTiming with a friend, you know, whatever you need to do to kind of like keep yourself balanced and healthy will have a great effect on your skin. Drinking plenty of water. Intermittent fasting. Intermittent fasting is a great way to promote autophagy, which has had a lot of research in the overall skin health benefits and other areas of medicine, your immune system and your nervous system. Autophagy that is increased by intermittent fasting has a lot of positive health benefits, including skin benefits as well. So if you go from the top, again, just to recap, if you can't do in-office procedures, medical grade skincare, if you can't afford an entire medical grade skincare line, try to get in with a deal or a giveaway. Like we give a giveaway for my YouTube subscribers almost every month. And then if you can't, then maybe just get one product from a medical grade skincare line and just supplement the rest from drugstore, more affordable products. If you can't afford any, even one product from a medical grade skincare, then stick with drugstore products that are the most impactful, like a vitamin A derivative or like a good sunscreen, or even using like Aquaphor or Vaseline around your eyes if you can't afford an eye serum. And then if you can't afford that, or if that's not in your budget, or if that's not possible, then at least living the best lifestyle you can with eating clean, intermittent fasting, drinking plenty of water, being happy, emotionally and physically healthy, and getting plenty of sleep, and just taking care of yourself. That would be my tiered approach to skincare on a budget. Next question is from MC9RU. So somebody asked about my surgeries that I've had that I mentioned in my most recent video. So I'm fully transparent with things that I've done and want to share this information with you guys as well. Again, I'm in the industry and I've been around lasers and injectables and energy-based devices since the early ages of my 20s. We were doing things to each other because we were more practicing on each other. Like I remember the residents running around at UCLA saying, does anybody have a patch of hair left that we can like laser to, you know, practice our laser hair removal techniques? By the end of the year, none of us had anything left. So we're trying to practice on each other and unintentionally giving each other anti-aging treatments starting in our early 20s. Did we need it? No, but it actually ended up benefiting me now in my late 40s because we did all of these treatments earlier in our 20s. But things that I couldn't achieve with lasers or energy-based devices alone were two things. I had an upper eyelid blepharoplasty when I was 40. I can't remember if I was 40 or 41. I'm 46 now. It was done by Dr. Ray Taban, who's an oculoplastic surgeon up in Beverly Hills. He's actually one of my good friends from medical school. He's a couple years ahead of me, but he trained at Jules Stein, which is a UCLA program under one of the world's best, most renowned oculoplastic surgeons. I actually perform upper lid blepharoplasty in my office as well. And if I would have been able to do the procedure on myself, I would have, but if I couldn't, I went to Dr. Ray Taban, who's amazing, and he did my upper eyelid blepharoplasty. And it just helped like open my eyes a little bit more. I'm glad I did it. I think it was a meaningful procedure and I posted it at the time when I did it and took everybody through my recovery process. The other question that she asked me about was my upper lip lift surgery. So lip lift is just when you take a little bit of the extra skin between the nose and the upper lip, especially if you want to avoid doing filler. Now I have a half a syringe of Vobella in my lips and I injected myself 2 or 3 months ago, and I do lip injections maybe every couple of years on myself, and I just do half a syringe of Vobella. I did do a lip lift surgery because I look weird when I do this now. This is not the result you want, but at the time it was just like a couple millimeters and it really made a big difference in that area. It was done by Dr. Monica Q, who's double board certified in facial plastics and ENT, which is otolaryngology, which is basically head and neck surgery. She's a badass mama, she's a working mom, and she's an incredible surgeon and a very dear friend of mine, and she actually did my upper lip lift surgery as well. And I had that done I think when I was around 41 years old as well, 40 or 41. That's when I kind of was like, okay, I need to like do a little touch-up tune-up on myself, and that's when I had those two procedures, not at the same time, but within that same year. Somebody asked me about those two procedures that I talked about in my earlier video, and the recovery for both of those procedures wasn't bad at all. I took about a week off of work so I wouldn't scare any of my patients, and had to refrain from lifting and working out and intense exercise for about 6 weeks. And then for the scars, I don't really have any scars. The upper eyelid blepharoplasty is a very forgiving surgery because the surgical crease goes within the crease of the upper eyelid. eyelid, so it's barely noticeable. Even with my patients, when I perform upper left surgery, you can't really see the scar. For my lip lift scar, you can kind of see it a little bit there, but I've done Fraxel on it 3 or 4 times, and I've done V-beam on it as well. And if I did more, it probably would be less noticeable, but it's almost to the point where you can't really even see it. So I think surgeries like that, little fine tunes here and there, are better along the course of a lifetime, as opposed to not doing anything and doing some big procedure where you're getting like a facelift and a neck lift and a blepharoplasty and a lip lift and fat transfer and like just too much too fast. I'd rather do like little tweaks along the way. And when it's time for me to have a facelift, which is probably going to be, you know, in my 50s coming up here pretty soon, I'll definitely post that and take you guys through that journey with me when it's time. It was so fun hanging out with you today. Keep the questions coming. Put the questions in the comment section so that I can see you and answer your questions in these vlog style videos. And then also be sure to subscribe to this channel, because you will be eligible to enter a giveaway when we give away our free MDAiRE skincare products. So that's another way to save money on skincare, is just subscribe to this channel and enter the giveaways to get free products. Also, just be sure to share this channel with anyone who wants non-sponsored content from a board certified dermatologist. So you guys, this is what I was talking about. This is the low Estrogen. It's a birth control pill that I've been in my entire life. Today is Thursday night. I'll be taking this. And I'm such a G, I just take it without water. Ugh, I can't take it without water, that's gross.